concern here in the U.S. and around the world. The Gardasil vaccine is given to girls and boys to stop the HPV virus from causing cervical cancer. But some are finding out it can lead to serious side effects. Channel 3's Susan Raff met with one mother who wishes her daughter never got the vaccine.
Corey spends most of her time going to doctors, getting all kinds of tests and medications. Her health has gotten so bad after getting the human papillomavirus vaccine. She's now doing IV treatments once a week.
I have nausea 24/7, dizziness 24/7. I have muscle pain, weakness in my legs, back pain, joint pain. Some days I have to walk with a cane.
Andrea Hurl says 2 years ago, their pediatrician recommended Corey get the Gardasil vaccine, which is given in 3 doses to prevent cervical cancer, which starts from HPV. After the first round, she says Corey was fine, but after the second...
She was sick within a week, back at the doctor's December 9th with nausea, which has not left her to this day.
Other children have gotten even worse side effects. A 16-year-old girl who was taken to Connecticut Children's Medical Center lost her eyesight. Doctors at the hospital believe the vaccine may have caused her blindness. The Gardasil vaccine made by Merck was approved in 2006 and is given to girls and boys as young as 11. While boys can't get cervical cancer, they can spread the HPV virus, which can lead to cancer.
80% of people will be exposed to and become infected by the HPV virus at least one point in their life. The majority of people clear it.
Dr. Jonathan Kozin is an oncologist at Hartford Hospital and feels like many doctors that the Gardasil vaccine is the best defense. The latest numbers show close to 12,000 American women are diagnosed with cervical cancer every year, and nearly 4,000 die. Corey is one of the few who have become sick from this vaccine, and in fact, the CDC says 8% or fewer do have serious adverse reactions. However, the percentage of people who actually get cervical cancer is far fewer from that, and some question whether the vaccine is worth the risk.
In Connecticut, it's about 6 women among 100,000 develop cervical cancer.
Dr. Singhan Lee stresses, however, very few women who get pap smears and regularly see their gynecologist develop cancer. And with early detection, it's treatable. He's known for his work. He's tested Gardasil vaccines from 9 countries at his lab in Milford. And in all the samples,
I found some human blood in autopsy case that contain the HPV DNA. It should not be there.
Dr. Lee says when blood combines with aluminum in the vaccine, it can be potentially toxic. He also says, unlike the flu shot, scientists do not need to include the virus in order for the vaccine to be effective. When we reached out to Merck about Dr. Lee's findings, they told us only small amounts of lab-grown or recombinant DNA are present and are not capable of causing infection or cancer. The FDA says there is no safety risk. If such a few percentage of people get cervical cancer, why the big push to have this vaccine?
That's a good question. Yeah? But in my opinion, it's a business motivated practice.
Everything has the potential for side effects. There's obviously a lot of hullabaloo about all kinds of vaccines. People have a lot of fears about them.
Andrea says she's not anti-vaccine, but wishes she and her daughter knew more about the Gardasil vaccine.
I would say I'm angry. I mean, I know it's not my mom's fault. I more so am frustrated because I'm not able to live my life.
Susan Raff, Channel 3, Eyewitness News.